Hello and welcome to a very interesting and relevant topic that we are discussing today. I'm Rucha Jain Kalra. With obesity cases spiking massively today, 1 in every 4 Indian adult is either overweight or obese. And India, you would be surprised to know, is looking at having nearly 44 crore obese people by 2050. With obesity becoming a big health challenge today, interventional treatments like a bariatric surgery have come up as options in many cases of morbid obesity. This is going to be a very interesting discussion as the subject has not received a lot of attention in terms of public awareness. How safe is a bariatric surgery and does the weight go off forever? Are some of the key talking points amongst a lot of questions that I have today for my illustrious panel of doctors. I would like to welcome Dr. Jayashree Todkar, laparoscopic and bariatric surgeon at Indian Institute for Metabolic Sciences, Pune. Welcome to the show, doctor. I also have with me on the panel Dr. Nandakishore Dukkipati, clinical director and chief surgeon at KIMS Live Life Hospitals, Hyderabad, Telangana. Good to have you with us, sir.
Great to be here. Thank you.
And we also have with us Dr. Amit Garg, consultant bariatric and metabolic surgeon, Cotsals at Park Hospitals, Mohali. Welcome to the show.
Thank you.
So I want to start with Dr. Jayashree first. What exactly is obesity in simple terms, and why is it now a health challenge for India? Because it's not just excess weight.
Yeah, obesity actually, by definition, is the excess weight which the body is not able to handle physiologically in a healthy manner. Obesity doesn't come only as the weight. It comes as a lot of chemistry. It's a lot of challenges to the body and which invites multiple diseases. Obesity itself is a chronic disease, but associated with it is nearly more than 110 diseases like type 2 diabetes, hypertension, fatty liver, various heart diseases, joints and spine diseases. And there are multiple respiratory problems, kidney problems, infertility related things, endocrine problems. This all is very badly affected with obesity. So itself a disease and multiple diseases, it comes as a risk factor. That is why it becomes one of the large things to handle. And as you said it very rightly, the pandemic itself is giving a strong burden on our own systems overall. So obesity needs to be treated in a very systematic way.
Right. I want to bring in Dr. Nandakishore here. So how does obesity increase the risk of type 2 diabetes in simple terms? Because diabetes is another massive issue that India is facing and grappling with.
Yeah, I mean, obesity and diabetes are like two entities that are really troubling our country as we speak. They're like the Rahu and the Ketu, if you will. So the obese person tends to put on weight around their tummy. So this is where we call the body shape as apples and pears, etc. People with apple body shape have more of a abdominal fat, which is the visceral fat, which is metabolically active, meaning that produces a lot of stress on your system and on the pancreas and insulin producing mechanism to a point where there is a element called insulin resistance that happens, meaning a body is producing insulin, either insulin is not enough or the body is failing to recognize the insulin that is being produced innately in the body. That is a mechanism by which the obesity contributes to a chronic inflammatory changes that leads to type 2 diabetes in most of the obese population. So the obesity and type 2 diabetes are very closely related. And interestingly, should you take care of obesity, should you manage to lose a certain amount of weight, it has a very positive impact on resolution or improvement of type 2 diabetes. So that's wherein lies the answer.
So now let's talk about the interventions like the bariatric or the metabolic surgery. Dr. Amit, how is this surgery different from regular weight loss attempts?
Bariatric surgery is also known as weight loss surgery or metabolic surgery. It is totally different from normal weight loss methods because bariatric surgery acts on 3 mechanisms. First is hunger. So after bariatric surgery, patients are able to control the hunger. Second is appetite. because bariatric surgery involves alteration of the stomach and rerouting of the intestine. So the hunger of the patient is taken care of. And third thing is energy level. So most of the patients with regular dieting, they often have like uh, continuous hunger. But after bariatric surgery, the metabolism is very high. So patients don't have to, they're very easy, it's very easy for the patient to take care of all these three things with the help of bariatric surgery. So that is the reason people are like very easily, they can lose around 10 to 15 kgs in the first 10 days also.
Oh, that's great. So, what are the most common bariatric procedures performed today in India for weight loss?
Routinely, we have only two procedures, which are the gold standard. First one is a Roux-en-Y gastric bypass and gastric sleeve surgery. So, but with the changing time, we are so many new procedures which are coming up, like mini gastric bypass. Now, since I am located in Punjab, it's one of the most common procedure performed in Punjab. But we are also shifting to new procedures like sleeve with the gastric sleeve with intestinal bypass, like proximal jejunal bypass, or gastric sleeve with the loop bipartition. So these are the recent modifications of bariatric surgery, but the gold standard remains the same, that Roux-en-Y gastric bypass and laparoscopic sleeve gastrectomy.
I want to draw in Dr. Jayashree. Dr. Jayashree, with this gaining momentum, with the metabolic surgery gaining a lot of acceptance, how do you decide that a patient is a right candidate or not for this?
So there are certain international guidelines which help us in understanding who is the right candidate for the operation. Traditionally, there were two types of patients who were supposed to be eligible for this operation. One, a BMI more than 40, that is body mass index more than 40 kilograms per meter square, is a straight away indication for the operation. Or the patient who is more than 35 BMI with any of the diseases which we listed in the first question, like type 2 diabetes, maybe obstructive sleep apnea, fatty liver, dyslipidemia, hypertension, etc. So any of the comorbidities and 35 BMI above that are the patients eligible. But recent guidelines with the recent most clinical evidence which has come over many years have shown that if done at the right time, these operations can provide the best effects to convert your bad metabolism into good and literally decrease the significant amount of the complications or the disease pattern or the medications required for the metabolic diseases. That is why the recent guidelines talk about more than 30 BMI with type 2 diabetes, which is uncontrolled by routine medications, should undergo surgery to control it better and to avoid the complications. It has to be accompanied by central obesity. And the second is above 35 BMI, each and everybody should undergo ideally this operation to get the control of the disease in a very long-term sustainable way.
Okay. Like you said, it improves metabolism. I want to ask Dr. Nandakishore, can a bariatric surgery actually reverse diabetes or improve it?
Absolutely it does. So most of the times when we perform a bariatric surgery on a patient, on a compliant patient, even before you actually see the weight loss, we happen to see a lot of beneficial effects in the control of type 2 diabetes and other metabolic conditions, because it is not purely linked to weight loss. There's a lot of hormonal metabolic changes that happen after bariatric surgery. There are some favorable hormones like peptide YY, GLP-1. A lot of these hormones, they get produced much faster in the body, which help in managing the high blood sugar levels. So in our practice, what we see is that within 48 hours after bariatric surgery, majority of the patients were able to discontinue the insulin dependence. Most of the insulin dependent diabetic patients, within 48 hours, within that hospital stay itself, we are able to convert them either into oral medications, or that heavy dose of 100 units or 150 units of insulin is being taken away. So bariatric surgery is an amazing tool for control of type 2 diabetes. And also those patients who are having a lot of complications, they tend to benefit substantially after bariatric surgery, even before they see substantial weight loss.
So are you suggesting that quickly the blood sugar levels start improving after surgery, even when the patient is at the hospital post-operation? Is that right?
Yes, absolutely.
Dr. Amit, a lot of people want to understand this from an expert's perspective, that how safe is it? How safe is to undergo bariatric surgery today? And what are the type of risks involved?
And with the modernization, bariatric surgery is as safe as gallbladder surgery. So our laparoscopy started from gallbladder surgery. So the risk is same as gallbladder surgery. With the advent of like high definition cameras, with the modern ICUs, modern OTs, and anesthesia, the things have become very easy. So most of our patients are able to walk 2 hours after the surgery, and they are discharged on third day. And coming to the side effects, there are so many risks or side effects which are mentioned on Google, but actually they're very rare, like the stapler line bleeding, leakage. If you use the proper technique and proper guidelines, the risk is very less.
Okay. Dr. Jayashree, do patients still need to change their lifestyle after they've undergone this kind of a surgery for weight loss?
Yes, it is true that patient has to make the compliance. Reason being, there are two typical conditions in the body which are voluntarily controllable and involuntarily controllable. So the involuntary part of the program in the obesity is taken care after the operation automatically. Typically, as we discussed, the appetite goes down, the satiation is early, the insulin resistance improves, and this is how patient starts becoming better. Now the patient's job is, one, take care of the diet in terms of good protein diet and avoid the high calorie foods on a frequent basis. So they can enjoy everything in life, but in moderation. That is the key. The second part is exercise is very important, because finally, if you build your muscles well, your insulin resistance goes down drastically, and that becomes your lifetime tool, which can be a very strong additive to your operation. So typically, to get the best result and a sustainable outcome in a long-term way, we should go ahead with diet and exercise patterns. But of course, as against the disease, when you have undergone surgery, the risks are pretty less of the disease, and even the restrictions are pretty less.
Oh, that's good to know. Dr. Nandakishore, a lot of people want to know that how permanent is the weight loss after the surgery? Are there any cases where people regain their weight?
See, again, going back to the client, so the procedures are the standardized, the results are very good. Having said that, there are certain guidelines one has to follow to maintain that sustained positive results. Just like Dr. Jayashree was just mentioning, a proper diet, taking supplements, adequate physical activity. If you do that, the results will be automatically maintained. We have patients who are maintaining their wonderful results for more than past 2 decades without any issues. Now, having said that, every once in a while, we do see patients who tend to regain weight. Again, majority of the times we are seeing the culprits being the food choices, let it be either high calorie sweets or certain cases alcohol, etc. When person stays away from such culprits, typically they tend to maintain really, really well, and they continue to have very good outcomes of their health.
Dr. Amit, there's a section of women, I'm talking about the pregnant women. Is bariatric surgery safe for them, and also for women who want to get pregnant later?
This is a very important question. Bariatric surgery is very safe in females, because most of the females are not able to conceive because of PCOD or irregular periods. And underlying problem is insulin resistance. And with that bariatric surgery, they are like able to conceive very easily. But according to guidelines, we recommend the patients to avoid pregnancy for at least 12 months to 18 months post bariatric surgery. And in a case they are able to conceive earlier also, they should be consulting a bariatric surgeon so that they can take supervised supplements during the pregnancy, because the dosage of supplements are little higher than a routine pregnancy.
Dr. Jayashree, how do weight loss medications, I want to talk about GLP-1 agnostics compared to surgery?
So the evidence that GLP-1 agonists can really help the patients in losing weight is the outcome of bariatric surgery. So over the centuries, people were trying to find out how to overcome obesity, and they literally tried to stop eating also. So jaw wiring was also done few years, decades back in patients, but it did not help the patients. Typically, after bariatric surgery, we understood that there are multiple mechanisms, not just the mechanical reduction of the size of the stomach, which helps the patient, but it initiates literally a lot of cascade of events, which helps the patient go to the better satiety, early satiety, making good food choices, and of course, changing the digestive system for the good. So this is called as a gut-brain axis. So from the GI, whatever chemicals are coming out, they are helping the brain understand the satiety and the appetite. GLP-1 analogs are helping this satiation to a good extent. And also they are helping in terms of reduction of the insulin resistance. So there are some mechanisms in the GI system which are helping the patients after bariatric surgery. One of them is GLP-1. It is not the only one. Yes, GLP-1 medications are helping the patients, no doubt. But again, they are not able to match bariatric surgery as much because the mechanisms which bariatric surgery covers are literally tenfold more than what the GLP-1s are covering. Number one. Number two, there is something which is known as a ghrelin, which is called as hunger hormone, which is not taken care by in the GLP-1 agonist treatment. So that remains again one big area which is uncovered by medications alone. Number three is, and a very important thing, surgery once done gives you that lifetime effect of the metabolic correction, which stays with you for the very, very long time. As against that, medications you take, and after some time, you literally need to increase the dose of the medications. Medications may not be tolerated by the patients very well because they give you bloating, uneasiness, little bit of nausea kind of things. Many patients cannot tolerate it. And the day you stop medications, many things start coming back very soon and very fast, which can get you back to the same level of your problem within 3 to 6 months. So typically, it is not matching the treatment of bariatric surgery as such today. But yes, it is important for us to have those medications in hand because then we can have a complementary system working with each other. So in some patients who are typically very, very bad in terms of fitness for surgery because of their heavy obesity, we can start with medication, downgrade the disease, and take them to the surgical level after some time, after better fitness. And some patients who get good result with bariatric surgery, and after many years, maybe some 10 years or so, if they start regaining the weight, then the medications can help us. So it has to be taken as a complementary system and not really they can replace each other.
Right. Also, Dr. Jayashree, why do you think in the Indian context, obesity and diabetes awareness are very important?
Typically, Indian subcontinent, we all belong to a South Asia kind of genomic system. This genotype is very, very, you can say typical in terms of thrifty genes or maybe thin fat Indians kind of body, wherein our body is better meant for good activity and can strive with lesser nutrition. Now is the time when many things are reversed. Easy availability, abundance of food, and typically sedentary lifestyle. This is all has led to a certain condition where the genes don't know how to deal with it. And typically insulin resistance comes up very heavily to us in terms of getting the diseases at a lower BMI. Because we look thin, but at the low BMI, our fat percentage is high. Understanding this, we have to make our lifestyle different, have the right time of interventions at the right level, and also maintenance or the compliance by the society in terms of the health. These all things are needed. So I think in all these situations, the literacy of the community in terms of health and the diseases is tremendously important, because ultimately it's a lifetime thing which you are supposed to take care of.
Right. Uh, Dr. Nandakishore, are there any pre-surgery tests or evaluations that are very much required before this kind of surgery is planned?
Very much so, because bariatric surgery is a lifelong commitment. So when a person is planning to, or a clinical practitioner is planning to offer such a procedure to his client, so a lot of investigations and verifications are required. The basic investigations that we do they consist of evaluating all the health systems in terms of the blood-based investigations. We look at the hemoglobin, their liver function tests, renal function tests, and the lipid profile. Also, moving ahead, we check their cardiac fitness with echocardiograms and treadmill tests where they can tolerate. If not, we can do dobutamine stress echo. Then also we look at their the anesthesia fitness, the airway, and all this is one side. And secondly, we also should look at their psychological slash mental fitness and acceptance to such procedures, because most of the folks who are gaining weight, they tend to enjoy food. They love to eat food, right? Majority. So, and in some people, the food becomes a comforting factor. They're unhappy, they're sad, they're disappointed. They revert to maybe a bit of an ice cream, maybe some other food that is comforting them and that gets them out of that little slump. Now, when the bariatric procedures come in, we are intentionally taking away that kind of a food material. So we need to evaluate a person to make sure that they can actually handle not eating such food material which is comforting to them after the surgical procedure is done. So the psychological mental evaluation prior to procedure becomes very, very important, and which tells us that yes, this particular client can actually manage post procedure also. So looking at their physical evaluation, looking at their blood investigations, cardiac fitness, and the psychological and mental fitness, these are all very integral and important parts of evaluation that we ask our patients to go through prior to offering them any kind of a bariatric surgical procedure.
Right. Dr. Amit, is it right that vitamin deficiencies are common after a bariatric surgery?
Yes. It again depends on the type of bariatric procedures. So if we do like gastric plication or gastric sleeve, the deficiencies are very less, but they are more common in malabsorptive procedures like mini gastric bypass or Roux-en-Y gastric bypass. And that is the reason we recommend all our patients to take lifelong supplements compulsorily. So the compliance has to be very good, because most of patients we have seen that they stop supplements after 6 months or 1 year. So those patients who are not taking supplements, they often land up in nutritional deficiencies. Second component is diet of the patient. So we have to encourage the patient to focus on high protein or balanced diet. So if the patient again continues with the carb diet, their chances of nutrition deficiencies are very high.
Right. Dr. Nandakishore, what are the benefits of bariatric surgery beyond weight loss and diabetes in terms of overall health?
Oh, the bariatric surgery today, it's an amazing tool. You can think of any health condition today, and you can actually see a demonstrable important improvement in most of these conditions. So as we know, the obesity causes so many health conditions, right? People tend to pick up migraines, they pick up strokes, heart disease, fatty liver, gallbladder stones, the joint-based conditions like knee pain, back pain, all these wear and tear of the joints, varicose veins, infertility, hormonal disturbances. Every single condition that is a result of obesity absolutely improves. And not only that, the kidney functioning improves, the fatty liver gets resolved in many of the cases. We're also seeing that some amount of fibrosis in the liver is getting resolved. Now, as you already know, type 2 diabetes and hypertension, high cholesterol levels, they also get resolved. Many of the times we are able to either lower the dosage, medication dosage substantially, or at times we are able to discontinue the medications of these established conditions after bariatric surgery, after a certain amount of weight loss. So, so we're seeing a significant amount of benefits besides weight loss, besides type 2 diabetes control. It's just not about numbers. Actually, people gain a lot of quality of life, a lot of self confidence, and we are seeing that many of these patients, after the weight loss and when their health conditions have improved, they are able to thoroughly enjoy their lives. Let's look at an old, like a grandfather who wishes to play with his grandchildren, but the knee joint, back pains, etc., are preventing them. But now they're able to achieve that. They're able to go out there and have fun. There are people that we know that who wish to climb the stairs of a temple to go visit their favorite deity, but then they're unable to climb the stairs. But with the weight loss, they're able to do that. Many patients are able to get off their insulin and day-to-day things that they find very burdensome, taking their insulin doses on a daily basis, checking their blood sugar levels every day. All these things are substantial benefits. And getting rid of infertility in younger population is like a biggest boon. And in younger population, we are seeing that there's a lot of social retraction when they're obese. So when the obesity goes away, they suddenly regain all that self-confidence. They're able to go back into public and be a social butterfly. There's so much of gratification in what we do. And that's the reason why we do what we do every day in performing these bariatric procedures.
That's wonderful to know. Dr. Jayashree, is bariatric surgery only for some obese people who have failed to manage or control their diet?
I think this is a very good question, because many times not in the patient's mind, but in the surrounding, maybe family and friends, spouses specifically, or parents, in their mind, it is the loss of control of the diet, which is leading to the kind of obesity the patients are facing. So it is loss of control is what people blame it to, but it is not so. See, typically, as we understand, the insulin resistance is the culprit, which doesn't let you do the diet. What is insulin resistance? It doesn't allow the calorie to be utilized by the cell in the meaningful way. That is where your cell is starving and you are literally craving for the food. So typically, if you see, obese people do not crave for volume. Otherwise, 10 cucumbers would take care of the things. It doesn't happen. They crave for the calorie because the cell is starving because of the no energy reaching it. This is where most of the patients will tell us they are foodie. They cannot do the dieting after a certain time. Or even if they try to, they literally fail in losing the weight. All these things are indicative that there is strong insulin resistance, which doesn't allow the patient to lose weight despite starvation. And starvation is a very difficult situation. That is where failure to do any kind of dietary control is not the criteria for patients who should undergo surgery or not.
Okay.
If you are having your certain BMI, see, remember, the international guidelines do not talk about whether you have tried diet or not. It talks typically about BMI and the comorbidities associated with the obesity. So
Right.
diet failures are very, very common in the obese patients, but that is not the time or the way or the criteria to say no for treatment to them.
Right. Dr. Nandakishore, is there any starting age where you decide that, okay, this is the age from where a bariatric surgery can be done? Can it be done on teenagers or young adults also?
So the guidelines basically are set as the age group 18 to 65. However, the adolescent obesity is highly prevalent in our country today. So if you visit any of these international schools in any given metropolitan or a cosmopolitan city, you can see the number of kids that are walking into these schools who are really overweight or massively obese. it's very scary to see the next generation walking in with all that kind of obesity. It's just going to lead them into a lot of healthcare issues. Now, for younger population, the adolescent obesity has to be done, can be done, but has to be done in a very specific and well-equipped and well-organized centers. Because this younger population, they have a different thought process and they may or may not have adequate mental maturity to appreciate as to why they are going through this procedure or why their parents are asking them to go through this procedure. So they need a lot of counseling, a lot of psychological support, a lot of emotional support. Having said that, we offer these procedures from age group of 13 onwards, and we're seeing very good results in those select population. But each person is different compared to the others. So each person needs to be handled appropriately, needs to be taken care of with those specific needs in mind and making sure that their emotional and psychological needs are met along with their health goals as well with the bariatric surgery. But in short, yes, we can offer the bariatric procedures in adolescent population, but it should be done in a highly selective manner in adequately equipped centers.
Right. Dr. Amit, now a very big and important question, that how expensive or affordable is a bariatric surgery in India, and also is it covered by insurance?
Ma'am, bariatric surgery is a life-saving surgery, so the cost should be the least concern. But in India, the cost is a major concern for Indian population. So the cost is much less as compared to Western countries. So in India, the cost varies from procedure to procedure. So there are a number of factors actually. The first is the choice of procedure. If we're doing sleeve or bypass the procedure, the cost varies. Second is from city to city. The cost is a little more higher on 3-tier cities as compared to smaller cities. And the third factor is the hospital. So the cost is more in bigger hospitals or multi-specialty hospitals as compared to smaller setups. Fourth is depending on the surgeon and the number of factors like choice of staplers and the surgeon. So all these things decide upon the cost of the patient. So at our center, we are depending upon the patient's budget, we are trying to do the surgeries accordingly.
Can you give some rough estimate that it starts from this and may go up to XYZ?
So on an average, the bariatric surgery, the cost starts from 2 lakhs to and it goes up to 4 lakhs. But nowadays it is covered under insurance. So it is also covered under central government health scheme and ECHS, where the package is approximately 2.5 lakhs. But when it comes under medical insurance, the package again varies from 4 to 6 lakhs. Because in the insurance, the packages are slightly different as compared to normal cash patients because of the number of factors.
Okay, right.
But still the cost is much less as compared to Western countries, because we get a lot of international patients from Australia and Dubai only because of the cost factor. Recently, we have done international patient Michelle from Australia. So there the cost was around 16 lakhs, but she paid only 3 lakhs here, in the total package, inclusive of everything.
That's very economical as compared to Western
very
countries.
economical.
In the end, I would like each of our panelists to give one message that you would want our viewers to take home today regarding bariatric surgery. If we could start with Dr. Jayashree.
So my message to people will be, bariatric surgery is a great scientific tool with strong clinical evidence, which can handle your obesity and all associated comorbidities in a very significant way, in a very long-term way, which can stay with you. And typically, it is very safe. Now also covered with insurance, it gives a lot of relief to patients. The message will be, obesity is a big disease and bariatric surgery is a wonderful tool. But if we act in time, then you can get the wonderful results, sustainable results, and you can enjoy them through the life.
Thank you. Dr. Nandakishore, please.
So, see, obesity is no longer a lifestyle condition. Obesity is a disease. Just like your other conditions like type 2 diabetes or hypertension, your heart disease, obesity is a disease, and it needs to be managed and taken care of as a disease and not as a lifestyle condition. So with obesity, the way you manage, there are a lot of confusing things that are happening in the management of obesity. We have newer medications, we have lifestyle advocates, we have bariatric surgeries. A lot of times it's very confusing for a person to select what is the right thing or the right option for them. If a person is morbidly obese, since it's a lifelong condition, it is always wise to opt for a option that works with you for the rest of your life. As opposed to if someone is only 10 or 15 kilos overweight, you can certainly consider all the other options like lifestyle modifications, newer medications that are coming up. But any which way, any which option you choose, obesity and the resulting health conditions can be very detrimental to a person's health. So the earlier you act upon this, the better it is. So before the health conditions and the complications of obesity set in, and one picks up the type 2 diabetes, hypertension, etc., before all these conditions set in, act early so that you can enjoy your life better, get the results earlier, and then you can live a disease-free life.
Right. Dr. Amit.
My message is very simple and short. We have only one life, and don't live with obesity and diabetes. When the treatment is available, why to live with it?
I think as a short and sweet, and what a wonderful way to conclude this discussion with this message. Thank you so much, doctors. This has been a lot of informative, engaging, and enriching discussion, because this is one topic in which a lot of people have interest, but they've not had this kind of awareness on what it takes to undergo it, and what all happens while you are on it. So thank you so much for sharing all the details, sharing the knowledge, and spreading awareness through this webinar. Thank you so much for sharing your valuable time and knowledge with us.